Hi, my name's Cara Munro. I would love to welcome you today to our Narrated PowerPoint on active listening. Active listening is a technique that's used across all sorts of different helping professions: psychologists, psychiatrists, AAD workers, nurses, any type of counsellors, all talk about active listening. Also in other fields such as mediation, peacekeeping, police, people who are working in hostage situations, anyone who needs to communicate in a way that has maximum efficacy will talk about active listening. So we're going to take a dive today into what are the components of active listening and how can you use active listening in your practice. To start with, the very term listening itself is an interesting one, and it is different from hearing. So hearing is just at a very basic level, a mechanical function. It's when sound comes into our ears, and listening, however, is what we do with that. Listening doesn't involve hearing. We listen for far more than just the sounds, and it involves interpreting and understanding, and today's session is really going to focus on listening. Quick diagram of the cyclical listening process. Mentioned hearing. Attending, that's when we actually make ourselves available to listen, not just to hear. Then we've got understanding as the next step in the process, and that involves a bit of interpretation and bringing our own knowledge, experience, our own past experience, our own learnings, and mixing them with what we're hearing and making sense of the message that we're receiving. Responding is when we give feedback to the person who's talking to let them know that we're with them, we're listening, we're not judging, please continue. And remembering is an important part of the process as well. Remembering could be remembering from previous sessions we've had with the same AOD client and things that they've shared with us in the past that we've listened to and how we can bring that back in. Could also be just remembering things from earlier on in this conversation when they explained or they set up the scenario, they gave names of people, they gave the name of their pet. Remembering those details is an important part of active listening. It shows that we've been attentive and that we've actually been taking in what they're saying, and what they're saying matters and is important. I'm just going to really quickly go through those steps in those cyclical process that we go through, and then we repeat and we repeat in a little bit more detail. So hearing, once again, it's when the sound wave hits the ear. I'm not a biologist or anything like that. I can't tell you in depth what's going on there. Something I will say, as our AOD workforce becomes more diverse, and hopefully as the years progress more and more, the AOD workforce starts to look like AOD clients, and the diversity in the general population, we're going to see more and more people entering the workforce and being really important leaders and teachers in our industry who don't hear through their ears, who don't hear in that manner, and are using assisted technology such as hearing aids, or indeed other modes of communication entirely, such as Auslan, sign language. It's a really exciting improvement, hopefully, in the diversity of our sector, and also it's going to open the doors for more diverse AOD clients to be able to really meaningfully access services and be properly heard and listened to in their first fluent language, or using with people who really understand the use of assisted technologies. So the first step is hearing, the second step attending, and this is one where so many communication breakdowns occur between drug and alcohol clients and their workers. Attending is about being available, being present, and being really switched on and tuned in or attuned to the person who's speaking. And it's not just about hearing, but it is about listening to what is being said, listening to the body language, listening to the way the person is in their body, in their room, in their space, the space that they're occupying. It's about blocking out distractions, and it's about being with the person. I've got a story that that I apologise if I've already shared it already, but it's one that stays in my mind as a good sort of good one to share in relation to this topic, and that's when I first started as a role of Senior Drug and Alcohol Advisor for Victoria's Youth Drug and Alcohol Advice Service, YODA. And I started work the very first day the service went live. So the day that the phones and the web chat and everything was turned on was my first day of work. And I was sitting in this tiny little office, and next to me was my boss. He was someone who I didn't know very well personally at all. We hadn't worked together before, but I knew of him. He had a fierce reputation as being really fantastic, excellent at what he does, very highly respected. And I remember the phone rang for the first time. I picked it up. It was a young woman on the phone. And I was listening to her. I was listening to what she was saying. But at the same time, there were all these other voices and messages inside my mind saying, careful, your boss is listening into you. Make sure you say the right thing. Make sure you use your very best counselling skills. Make sure you're actively listening. What should you refer her to? Could she be appropriate for that service? You should ask her where she lives. Then you can find out what area she's in, and then you can work out what service to refer her to. Then you can make a referral, and that will look really impressive. It will also help her. And so I had all these, even as I'm telling the story, I notice my own voice speeds up, because that was the sort of voice that was going on inside my mind. It was a very frantic voice. It was a bit panicked. It was keen to impress. It was the voice of my ego. And that voice was drowning out the voice of the young person who was on the phone, who actually I was there to support. My ability to attend to her was really compromised. Now, that doesn't make me a bad person, and it doesn't make me a bad AOD worker. However, in that moment, I wasn't offering her the best service that I could and that I should have. And there are a whole heap of factors that were influencing my capacity to attend to her, including my own insecurities, my own ego, my own perfectionism and desire to be really good at what I was doing and get a really good outcome for her. So I'm not sure what her experience was. I think she probably would have thought, oh yeah, that lady was nice, she was friendly, she helped me out a little bit, but I highly doubt she would have said, I really felt heard. I highly doubt that. Something to be mindful of. Understanding, the second step in the process. And once again, assuming that we've tuned in, we've been present to the person, this is where a lot of breakdowns can happen once again. Understanding is when we sort of take on board what's being said verbally and non-verbally, what's being said explicitly, clearly explained, and what's being said implicitly, the unspoken message that's being communicated. We put that together and we mush that in with our own past experience, with our own understanding, also with our own assumptions perhaps, and we interpret what we think that person is trying to communicate to us, the fullness of the message. And there's a risk here that we will get it wrong. It's possible, of course, that we might get it right and we might exactly understand, but there's a risk that they might be talking about substance use that we ourselves have used, and they had a very different experience to us, but we, rather than asking questions and finding out more and being curious, we just instantly assume that we know, move on, and we integrate what our experience of that drug has been into what the person's saying. And so we might not fully understand their perspective, we just have a partial understanding. This can happen also with cultural assumptions. If the person is from a culture that we are not familiar with ourselves, and they might be talking about, for example, family, and they might be chatting about family in a way that if they were speaking to someone from their culture, that person would get it, they'd be on the same page. And we have a family, they're talking about family, so we just assume that, you know, their ideas around family are very similar to ours, and so we think we get it as well. But actually we might have two people who are speaking about family in two different ways, and there's a real misunderstanding that can occur. And then we've got responding, and this is when feedback is given to the speaker, and it's really important in active listening to respond in a way that doesn't derail the speaker. So what will often happen in white Australian culture, while someone is talking, the person listening is forming up what they're going to say. They're thinking of something smart. They're thinking of, if I'm married to someone who used to be a stand-up comedian, and sometimes I can see him, and in his mind I can see a joke forming. He's a very witty, very smart, life of the party person, but that compromises your ability to listen, right? If someone's talking and midway through you tune out and you're making a joke in your head that you're going to say when they've finished, you miss the second half of it, okay? So we can do this as therapists as well. Someone says something, we think, oh, I'm going to offer a harm reduction strategy at the end of this, as soon as they stop speaking. So we tune out and we prepare what we're going to say. That's not active listening, okay? That's psychoeducation. Can also be helpful, but active, that's later. We'll do that later. For the moment, it's important to listen and respond, give responses that aren't intrusive. So it might be non-verbal, such as nodding, smiling, having warm body gestures, or even looking sad when they're saying something sad. That's a way of responding. It could be non-verbal as well, saying, gosh, yes, that must have been stressful, or, small little comments that don't make the speaker then change the course of what they're saying and start, shift the agenda of what they're saying. It just lets them know that you're still with them, you're listening, you're present, you're attuned. And remembering. Now, this is a tricky one. It's wonderful when a client comes back to a service, 2-3 weeks, and the AD worker remembers the name of their kids, the name of their dog, remembers little comments that they might have said last time, like, for example, the way they describe the way they feel when they're substance affected or coming down, and the worker actually uses that same way of describing it, uses the same words, the same phrase. That can be very validating, and it reinforces to a person, okay, this AED worker is invested in me. They're paying attention, they're listening, they're remembering, and they're showing me that they're interested in me as an individual. I'm not just some, yet another client that they've got. Problem is, human beings, and especially as we get a bit older, right, our memory is not always fantastic, so our memories can fail us, and that's fine. The important thing is to not fake it, to be transparent. So if they're talking about an important person in their life whose name they mentioned last time but who you can't remember, it's okay to say, I'm so sorry, I can't remember their name. Can you recap me? Don't make it about you. Just do it quickly. Get the information, pull back out, keep listening. Don't make it a conversation about your failing memory and your aging process. Save that for your friends at home. That's about you. The same thing can happen sometimes, and I've had this experience where someone's talking and you're recalling a past conversation, but you actually didn't have it with them, you had it with another client. And so people can get their clients mixed up. They have quite similar experiences, but your memory can accidentally switch, the experiences of two clients. And that can be, at worst, it could mean you break confidence. You start, you say, oh yeah, I remember that you moved in with your auntie and she had to take out a restraining order, and they say, no, what? No, my auntie didn't take out a restraining order on my boyfriend. Who's what? And you're actually giving someone else's information, which could be awful. Or it could just be, they just feel a bit unvalidated and they feel like you're sort of you weren't really listening, you weren't really paying attention. So, be cautious, be careful, be really honest about your memory. If you don't remember something, don't fake it till you make it. Just be really honest and say, sorry can you fill me in on that bit of the story? I think I missed it. And, then continue. And that's fine. Everyone understands that memory is hard. Types of listening. I won't spend too much time on this slide. You're welcome to go through it in your own time. I'd love to draw your attention to number 1 and number 4 though. Now, number 4, empathetic listening, is the type of listening that ideally you will be doing majority of the time as an AAD worker. If you haven't heard of empathy before, I really encourage you to look up an amazing woman called Brene Brown, who's been doing a lot of work in recent years about empathy. She's got some great TED Talks and other resources and books and little cartoons and videos as well. Empathy is sort of in the same family as sympathy and compassion, but empathy is not about feeling sorry for someone or feeling sadness for someone. It's feeling alongside someone. So an empathetic listener is someone who is attempting to understand the experience of another person and see their experience through their eyes and not feel pity for them, not look down on them and, oh, poor you, nothing like that. But it's a very dignified way of listening, just to acknowledge what they're sharing, what they're saying, and be present to it. Then I'm going to jump up to number 1 and very briefly touch on that. Informational listening. Now, informational listening at its worst can be really cold and transactional. And think about doing an assessment to go into a drug and alcohol service. You don't want to be doing that with someone who you can't read their body language. They're really cold, they're really clinical, they're just asking questions, you're giving them answers, you're feeling vulnerable. So informational listening can be, really off-putting. It can also be helpful sometimes, and I'll return again to the instance of if you're working as an AAD intake worker, you might be working with people who want to start, they want to go to a rehab or a detox or something like that. They need to fill out a whole heap of paperwork to get in. You're the worker assigned to go through that with them. It's possible that you'll never work with them again in the future. This is a one-off meeting. So you don't want to be unpacking trauma with them. You don't want to be going into huge detail and them revealing their soul to you only to have to do it all over again with a new worker on another day. That's not helpful. That's not appropriate. Sometimes it can be helpful to be an active listener. So be very respectful and show all those values and techniques that active listeners show. But we're not going deeply into a therapeutic conversation. You're just going through paperwork with them, getting information, giving them information as well about, the process, and supporting them to get the paperwork done as quickly and as cleanly and as accurately as possible. And you can be, in a way, a little bit matter-of-fact can be helpful because it's a process that they need to do, and you can just be really honest in that, and that's okay as well. It's still very important to be a human and be understanding of the vulnerability, but you can your interaction can be based around the goal of getting this task done, that shared goal, and that's completely fine. And that brings us to types of listeners. So I'm going to focus mainly on number 1 and number 4. Number 4 being an active listener, which this whole presentation is about. But and an active listener is someone who their posture, they're orientated towards the person, they're alert, they're not sleepy or dreamy or off in their own world. They're giving full direct attention. They're listening to what's being said and also what's not being said. What's being said communicated through body language and communicated implicitly as well as explicitly. There's someone who is concerned with hearing what's being said and understanding more deeply and asking curious questions. They're not waiting for their chance to speak. They're not waiting to talk about what they think should be going on or share their views or points of view or values. They're really interested in listening, not in conversing. It's not a conversation that you would have with a friend, where you're both sort of talking equally and chatting away about things for entertainment purposes and to bond. It's a type of communication where one person really takes on the role of a listener more so than a talker. That's active listening. I'd love to jump up to number 1, detached, because that's something that you will see, and you may even be a detached listener from time to time. I know I have. In the drug and alcohol workforce, there are many things that can cause someone to become a detached listener. And so firstly, what is a detached listener? Someone who's avoiding eye contact. They might seem withdrawn, they might not seem enthusiastic, they seem disinterested, they might seem distracted. So this seems really awful. It's easy to judge a detached listener, right? But there can be some really solid reasons for that. There could be, think about an AOD worker who's chatting to a family member or a client, and in a large open space like a day program, and they notice that an altercation is happening in the corner. There are 2 other clients who their voices are starting to get raised, are starting to get elevated. Something unsafe might be about to happen. They're going to become a detached listener. The conversation that they're in at the moment, they might sort of be tuning out from because they're tuning in over there for safety reasons. Detachment can also come, and this is, I'm sad to say this, but worker burnout is a huge issue in the drug and alcohol industry. And burnout's something that you'll hear about. It's when a person has been working in drug and alcohol, they're very committed, they give a lot of themselves, they give a lot of their emotional strength to their work, and in the course of their work they don't experience sufficient support to do the emotional labour that they're doing, and they sustain a psychological injury. Often it's accumulative over time where they're not properly supported by the system structures and people. And they become, it's like a form of mental illness where they really become burnt out, emotionally exhausted, and have their own survival urge kicks in and causes them to want to retreat. They don't want to be fully involved in conversations because it's wounding, it's difficult for them to be present and hear about other people's experiences. And so what you can see in workers who are burnt out is behaviours where they become withdrawn and detached. They might appear to lack enthusiasm, become a bit cynical. They might seem disinterested. They're also always sort of hiding in the staff room rather than, being fully engaged with clients. And when they're listening, they might seem partially shut off, or sort of withdrawn or within their own self rather than being really with a person. And when this occurs, these people really they really need support to recover. They need support to regain their capacity to be open and attuned. It's something, look, I personally have really strong views and opinions about systemic failings, that people shouldn't be getting burnt out at the rates that they are, and we could be doing more to prevent this and to support them. But if you're working with someone, with a colleague who seems really detached and they themselves maybe say that they're burnt out, something I really want you to remember, it's easy to go into judgment because you're going to think, oh, they're not a very good worker. They're not very empathetic. They're not a very good active listener. But something I want you to remember is burnout can only happen to very committed people. Okay, if you're not really that committed or passionate about it all in the first place, you're not going to get burnt out. So something to remember, burnout is a sign of commitment often, or is a shadow side of commitment when commitment's been unsupported. So just remember that if you are working with colleagues who are listening in a detached way, and that's the reason. Okay. Elements of active listening. These are the building blocks. These are the micro skills. When you put them all together, it creates fabulous active listening. So firstly, pay attention. Seems so simple, can be so hard. My example of being on the phone to that young woman, and I had every intention to pay attention to her, but I really wasn't. I was paying attention to my own stuff, my own perfectionism, my own need to be seen as proving myself and doing a good job, my own ego. So there's some very simple, concrete ways that you can show that you're paying attention, and there's other things that you need to do within yourself in knowing yourself to be able to fully pay attention. For example, once again, going back to that example I shared with you, things that were stopping me from paying attention were having a perfectionist attitude, being a bit too concerned about what my colleagues thought of me, wanting to be a people pleaser. So these are things that I need to work on over the long haul, right? They're not things that I can instantly change about myself, but they're things that I can be aware of and I can slowly work towards. And as I do that outside of work, that will increase my capacity to be a great AAD worker and to pay attention and be fully present. And then if you're paying attention, you want to also show the person that you are listening. Has anyone ever, actually I'll give you another example from my practice currently as a teacher online, is sometimes I'll be chatting to the laptop screen and I can't see anyone. There's no videos on, there's no one's got their mics on, and I'm talking, and then suddenly there's a little voice goes off in my mind and I'm like, is anyone there? Are they tuning out? Am I sounding like an idiot? Have I over disclosed something? I start to feel vulnerable, start to feel like what I'm saying might not be interesting. And once again, all these voices pop in and start, saying undermining things. And all of you who've been in a online classroom with me will know that sometimes I say, can you please give me a hands up? Can you let me know that you're there? And that's me wanting you to show that you're listening. And when that happens, I can instantly get rid of all those negative self-thoughts that are going on and just continue focusing on delivering the message. So we want, that virtual hands up that's very reassuring to a teacher in an online environment. We want to give that to our clients all the time. And how do we do that? We do that by using our bodies, by nodding, by smiling. If they're saying something sad, we look sad in our face. If they're saying something amusing, we look amused in our face. We use our body in the same way, our body language. We might make small just give a few words or some sounds like, oh gosh, yes, I'm hearing you, yes, those sorts of, they're not even words, they're just sounds that let the person know that we're there, that we're with them. Really, really important. It's also important that we show we're listening in a way that doesn't derail their train of thought. So they're talking, they're in a train of thought. We don't want to say, oh yes, I totally understand what you're saying. My neighbour had this experience exactly the same way. And suddenly we go into a story. And we don't want to divert the course of what they're saying and what they're sharing. And once again, we don't want to make it about us or our neighbour. So we can just use very small ways to show that we're listening. Less is more, okay? And providing feedback. This is sort of showing that you're listening, but providing feedback, asking some questions. Ask a question that you don't know the answer to. Don't ask a question that's loaded where you're trying to get them to realise something about themselves. No. Genuinely ask them a question that will deepen their understanding and your understanding of what's going on. We'll talk a little bit more about this later on in the presentation. Reflect on what's being said by paraphrasing and seek clarification. So, it's okay to sort of chime in and just, if you haven't heard something properly, or if they said something you can't quite remember the detail and you just want to check in, seek clarification. That's really good. It shows that you're listening. It shows that you're seeking to get it right. It shows that you're seeking to understand from their perspective exactly as it is. You're not just skimming over bits that you might have misheard. And summarising the speaker's comments, we'll talk a little bit more about this in some future slides. Really powerful skill, okay? And then responding appropriately. With this first one, assert your opinions respectively. So I offer a little bit of caution about that, because active listening is not about debating. It's not about winning an argument. It's not about winning a person over to seeing your perspective because you've got answers that they don't. It's just about listening. It's just about hearing what they want to share and respectfully being alongside them, being with them while they're sharing. And it's also about acknowledging that sometimes in the act of sharing, in the act of talking, when we talk, we also hear, and sometimes, oftentimes, we actually come to our own new understandings, new conclusions, new realizations through the act of doing that. We don't need a person there offering and interjecting with their opinions on what we should or shouldn't do. And deferring judgment. Now, this is a huge one, and I've written the term unconditional positive regard and the name Carl Rogers there. Carl Rogers was I think he was a psychiatrist actually in the 1940s, and in, I believe, 1957, he spoke about the essential conditions that are needed, the 6 essential conditions that are needed in a relationship where change can occur. For example, a relationship between an AOD worker and an AOD client, and unconditional positive regard was one of the essential conditions. And it's basically not judging that person, thinking the best of that person, regardless of what you know about what they've done or may have done to others, crimes they've been involved with, things they've done or do, or values they hold which might really jar with your own personal values. We still need to meet people and view them through the lens of positive regard, be willing and open to see them as a positive, see them positively and without judgment. Very challenging to do, very tricky. And if you're working with someone who really, the things that they represent in their life really challenge the things that you hold firm, then it's very important to get your own supervision and reflective practice, to talk to senior colleagues or peers or your manager about how you're going to manage this and how you can really be there for them in a way that they're not experiencing judgment from you, okay? Very hard, very challenging, but very necessary. And now we come to paraphrasing. This is probably one of the techniques that's most closely associated with active listening. Now, paraphrasing is basically just reflecting back to the person what you've heard. So as I mentioned earlier on in this recording, when we speak, we're not just speaking, but we're also hearing what we've spoken. And when someone paraphrases back, so echoes the same thing that we've just said, we hear it for the second time. And something that can happen with great active listening is a person will be speaking and they'll be following their own train of thought. And with a great active listener at their side who's encouraging them to deepen their train of thought and elaborate on it and go further, and as the active listener is seeking to understand and is being curious and not being judgmental, just being accepting and holding. What can happen is when we're speaking, we actually develop thoughts. So the process of speaking itself allows us to uncover thoughts that we wouldn't have uncovered had we just sat with our own thoughts in our own mind. Actually, the process of saying them out loud and in the presence of another person enables us to strike on new ideas, new concepts, new possibilities that were very deep within us, but they hadn't actually had a chance to come to the surface, and we might never have noticed them. So what paraphrasing does is it's a way to just deepen that atmosphere around the person who's speaking with, I guess, allowing them to hear some of the key things that they've said being repeated back, and drawing it back to their attention, and then allowing them to deepen their thought process and thought content. Here are some examples here of how you might do that. So someone might say, I'm just feeling terrified that if I have a go and I make a mistake, it might set me back further. That might be what they say. So you might say to them, I'm not sure I'm with you, but I think I'm hearing you're terrified that if you try and you don't succeed, that might set you back further. You might say, if I'm hearing you correctly, I hear that you're terrified that if you try but then you don't succeed, that might actually set you back. It appears to you that you're quite terrified that if you try but then you're not successful, you might actually get set back. So these are all ways that we can gift back to the person their own insight that they came up with, that they created, that came from them, and we're just offering it back to them so then they can have a look at it again, see it, question it, consider it, pull it apart, understand more about it. Something that happens often while someone is talking, we are waiting for our chance to speak. And as therapists, as AOD workers, sometimes someone will say something and then we're thinking, oh, this is what I'm going to say next. I've got an idea. I've got something that will solve. I've been in exactly that position before. I'll share with them my experience. When we do that, we rob them the opportunity of self-discovery. When we are an active listener, we believe in them. We trust that they will come to whatever it is they need to come to. We're not going to rush in and give them our learnings. We're going to sit patiently with them while they come up with their own learnings, and their own learnings will be so much more powerful than the one that we discovered for ourselves. Self-discovery is a very important thing. I've got here, I just chucked in a little comment, which is double-barreled statements. This is something that's used a lot in family therapy. And when you're paraphrasing back, sometimes what you can do is you're listening to someone and they're saying, this is going on and I feel this way, but on the other hand, I also feel like this is going on. So it could be, for example, they're talking about how they really get a lot out of their alcohol use. It really helps them with confidence and to feel normal, and help them to sort of function and feel reassured. At the same time, they're scared about becoming like their own mother who is an alcoholic, and the disruption that it causes in family and the alienation that their kids might feel. So we've got two concepts together, and they're both, in some ways they're contradictory. They're both, two different views on the alcohol use, but they both belong. So it's not one or the other. So double-barreled statements are a way for you to acknowledge and paraphrase back two things that are happening at the same time that might seem like they're in conflict, but actually they're both real, they're both relevant. So, you might be able to paraphrase back, look, I'm hearing you say on the one hand, your alcohol is really functional, it's really helping you with confidence, and it's helping you to function and helping you to do what you need to do, including being a mother. On the other hand, I'm hearing that fear that of what alcohol did between your relationship with your own mother-daughter relationship, and that fear that that's going to be replicated with your daughters as well. I'm hearing these two things. So double-barreled statements can be very powerful in bringing nuance and showing that you understand the complexity of the situation. It's a risk that an AOD worker in that scenario might focus on, oh yeah, your daughter, you definitely don't want to break down your relationship with your daughter. That'll be terrible. Like, think about your own mother, think about the destruction. You have the opportunity to not do that now. When we come in and just acknowledge part of what a person is communicating. We don't acknowledge the other part. It can lead a person to feel judged or backed into a corner, that we have expectations on what they should do, think or feel, and that we haven't fully understood the complexity of the scenario. So these double-barreled statements allow us to acknowledge all facets, and there might be 3 facets, a triple-barreled statement, right? There may be many separate facets, but we want to not give heaps of focus on one because we think that's a positive one, and less focus on another because we think that's negative. We want to give focus to both of them, and often what will happen, if without judgment we're just paraphrase back what we're hearing, the person themselves will then sift out, and they might, they might say, yeah, alcohol is really important to me, but I think really, the more I think about it, the more I need to remind myself about my children and do this for them, or something like that. They themselves will come to whatever it is they need to come to. We don't have to impose what we think they should do. And paraphrasing is a tool to support them to do that. It's a beautiful tool. It's a simple tool. And then open-ended questions. Many of you will already be familiar with open-ended questions. They're the opposite of a closed-ended question. Closed-ended question is, do you like drinking? Yes or no? An open-ended question is, can you explain to me what it is that the alcohol does for you that's positive in your life? Can you share with me what would be lost if you stopped drinking tomorrow? What would be the things that you fear that you would lose? Yeah, these are questions that firstly, you can't answer for a person, so you need to show genuine curiosity. You need to really sit at their feet and make sure that they are in the position of expert, right? When you're asking these open-ended questions, you're asking to genuinely get a sense of understanding from their perspective. You're not imposing your perspective on them. You're hearing and you're listening from their perspective. And you're also giving them an opportunity to explore a question they may not have asked themselves. They might have asked themselves a more simplified version of that question, but you're giving them an opportunity to depth down into their own knowledge, into their own expertise, into their own understandings and experiences, and sort of go a bit deeper into the information that they've got. And then once you also use the tool of paraphrasing back, when they sort of share with you what it is that life might be like if they lost alcohol, what's the gap, what are the fears. Once they put words to that, you can then paraphrase back. I hear you saying that you're scared that you won't be as interesting a person, that you'll be a bit beige. That's the fear that I'm hearing. And when they hear that back, that might give them, then it opens the door to then explore that concept further, and that might lead to, okay, what do I need? What does that indicate? What's a gap in life that we can work together towards filling, so that fear is not going to loom as large, it's not going to be as big, it's not going to be as powerful. So active listening is a really amazing tool to support self-discovery, and that self-discovery leads to treatment planning, care planning, forming a plan of what you're going to do, and what are the really meaningful changes that you can work towards together. And once again, here's some examples of some open-ended questions. What alternatives have you thought about? What do you mean what could some of the consequences be? Be careful of that one. You don't want to become an AAD worker who's, let's list the pros and the cons, and let's focus in on all the pros of why your drinking's dangerous. There's a lot of judgment in that. It's a technique that can be used. I've seen it used a lot, but we want to be very careful. With open-ended questions, always try and ask a question that you yourself do not have already some preconceived answers to, that you're not asking them a question because you want them to say something that you want them to know. You're genuinely curious. This is me speaking as an arts therapist now, and something that's used a lot in the arts therapy world and the world of somatic experiencing is if someone has a bodily sensation, so a bodily felt sense like a, fastly beating heart, or a sick feeling in the pit of your stomach, or, a flicking sort of headache, or a buzzing in the head, or, these uncomfortable bodily sensations that we can get when we're really going through heavy emotional terrain. Some beautiful open-ended questions could be, what if you could give that feeling in your stomach a name, what would it be? If you could describe that feeling in your heart, how would you describe it? What do you think the message that that feeling in your stomach, do you think it's giving you a message, and what might that message be? Do you think it's giving you a message as a closed-ended question, actually? Yes or no? But an open-ended question, what do you think that feeling in your stomach is trying to tell you? Is there some wisdom in that feeling in your stomach for you? These are, these are getting into more sort of the psychotherapy type questions, but beautiful, interesting, curious questions that can lead to really, really powerful personal self-discoveries. More elements of active listening, non-verbal gestures. We've touched on this already. I love this statement. In many ways, active listening is characterized more by what is not done than what is done. Beyond the words, there'll be a host of cues as to what the speaker or listener is communicating. You should avoid sending out negative non-verbal gestures, but if you're too immersed in yourself, others will feel you are uninterested, disrespectful, and/or rude. I've got some examples here of some inappropriate non-verbal gestures. There's one I was recently, actually just earlier today, I was watching a documentary on SBS called Addiction Australia, and it's one that I recommend to everyone. But there was a really interesting scene in it that stuck in my mind, and I thought, oh, okay, that's really relevant to this unit that we're studying. And what was happening was there was a man who was in detox for heroin use, and he'd just been prescribed a medication called Suboxone and had gone into something called precipitated withdrawal. With this medication, Suboxone, fantastic life-saving, life-changing medication. But in the very early stages, if you've still got heroin in your system and you take Suboxone, the Suboxone kicks the heroin out of your system and it sends you into withdrawal, a temporary state of withdrawal, very uncomfortable, very sudden. And so this man was lying in a hospital bed and he was sort of crouched in. He was lying down, crouched in with his legs sort of crouched up. People often get cramps in the abdomen and that sort of thing. And he was lying in bed, and the addiction medicine specialist, he's actually a fantastic practitioner. He's really awesome and great with people. But obviously he's got a camera crew there following, everything. It's a bit of an artificial scenario for him. He came in to visit this patient and he's standing there in a suit with a lanyard. He's a very tall man, and he was standing there saying, "Hey, how are you feeling?" And he's hovering over the bed up really high, and this man is crouched down, lying in the bed. And inside myself I was saying, squat down, squat down, squat down. And I just wanted him to just sort of crouch down at the bedside and make it so at least his eye level was the same as the man, or better still, it was a little bit lower and he was looking up. That would be much less threatening, much less personable. It would show, being tuned in, being genuine. You're not standing there against the wall ready to dart out at any minute, ready to run. You're there. You're ready to listen. He didn't do that, unfortunately, But when we talk about non-verbal gestures, there's the smiles, there's the way we use our body, there's the way we use our hands, the way we position ourselves facing or side by side. There's also the way we inhabit space in the room, how high we are, how low we are, the distance between people. So every human being has an imaginary ring around us, like a fence or a boundary, and that space, that ring divides the space, our personal space, that we only have very intimate, lovers and friends and family are allowed close enough into that space, or people briefly giving us a hug or something like that. We usually prefer people not to be in that space. Everyone has an imaginary ring around them, and be aware of your imaginary ring that's around you, how close you allow people to come, and also be super aware of the imaginary ring around your clients. If you're walking towards them, sitting with them, and you notice they're sort of backing off a little bit, move back. You're in their ring. Yep, you're in their personal space. Move back away. Make sure that you're outside of that ring and you're not infringing on their space. So you just be aware of where you locate yourself within the space together. And we've got 2 videos here. I'll make some links available to you. Fab examples, good active listening and very bad listening. Also a bit of coercion going on in there. Have a watch of these 2 videos, see what techniques you can pick up that are being used or not being used. See if you can notice the response on the part of the client. Is the conversation deepening? Is the client withdrawing? Is there a hostility that's beginning? And also notice within yourself how you feel, what emotions are coming up for you as you're watching it. How is your body responding to what's going on? Have a listen to that and see what happens. It can be quite fascinating. We're getting towards the end of this slide and demonstrating respect. If you are using all these active listening skills, the experience for your client will be that they are being respected. Okay, so put all these active listening skills together, use them well, and it's probably the best chance you're going to have of communicating to someone that you respect them, you respect what they have to say, you're interested in what they have to say is important. It's actually more important than what you have to say on the topic, and that you believe in them, and that you also respect their ability to come to their own conclusions, make their own judgments. They don't need you there interjecting with what you think or what your interpretation is or what's going on for you. It's a high show of respect. I've added one more slide here, and this is not about active listening, but something I'd love to say is when you've mastered the essential skills of active listening, what you can then do is layer other psychotherapeutic skills on top of that, okay? So active listening is transferable. It's a amazing foundation, but then you can learn other techniques, other therapeutic techniques, and add them in as well as active listening. Never lose active listening, always keep that, but you just add other techniques on top. And you can also add other value systems on top as well, okay? So here I want to talk about a person-centered approach. I've got the name Carl Rogers there. He was operating sort of from the 1940s onwards in the realm of psychotherapy, and very, very influential person who has contributed a lot to the type of counselling practices that AOD workers do nowadays, are very much influenced by Carl Rogers. And person-centered approach is something that you'll hear about a lot. I really encourage you to look it up. It's not in your assessments or anything like that, but so valuable. So something that I think a lot of you will read about and you go, yes, I agree with that. Wow, that's fantastic. Carl Rogers in 1957, he identified 6 conditions that are essential in a relationship where change is to occur. So for example, in the relationship between an AOD worker and an AOD client, that's a relationship where two people come together with the purpose of supporting the AOD client to make changes to their substance use. So in these sorts of change relationships, Carl Rogers identified that there are 6 key conditions that are necessary. And 3 of them have really caught on and sort of are known by everyone and spoken about a lot and practiced a lot. And these 3 are empathy. I think I mentioned earlier in the narrated PowerPoint, Brene Brown is a good person to look up if you're interested in learning more about empathy. Unconditional positive regard, which is really about that non-judgment and seeing people through the lens of seeking to see the best in them. And some it links in well to a strength-based approach that we hear a lot about in AOD. And congruence. This might sound like a weird word. Congruence is actually not about the client. Congruence is about you as an AOD worker. And congruence is about genuineness, and it's about your self-belief, what you understand of yourself, who you understand yourself to be, matching as closely as possible as the outward self that you share with others. So the opposite of congruence would be wearing a mask, being fake, being inauthentic. Now, congruence is not about wearing all your life story and your trauma and your substance use and all your experiences. It's not about walking into a room and divulging everything and saying, this is who I am, spilling out everything and sharing that. That's not congruence. That's self-indulgence, okay? Congruence is about, at any given time, we're not sharing entirely everything of ourselves explicitly, okay? But we can still be authentic. We can still be present. So congruence is about knowing yourself well and trying to make sure the self that you share matches the self that you know. It's not about over-disclosure. They're two quite different things. When we're seeking to be congruent, we're doing that. The meaning behind that is we want to do that in service of the AOD client. We want to do that to support them towards health. It's not about serving ourselves, okay? Something really important. And I've got two more little dot points here. I think I've touched on both of them throughout this PowerPoint. I'm going to go to self-compassion first. I'm going to quote the Dalai Lama. Why not? Sensitivity to the suffering of self and others and a deep commitment to try to relieve it. So self-compassion is just acknowledging that, gosh, we all suffer. It's part of being human. And we're going to try to prevent or relieve that suffering, and being gracious and, being understanding that we as AOD workers get it wrong, clients will get it wrong. We need not dwell on those things, but just acknowledge that we're humans trying to do our best, right? And be sympathetic to that. And this ties in really well to humanist beliefs. And this is something I really, perhaps possibly one of the most important things in this whole narrated PowerPoint. It's a belief system, and Carl Rogers was, once again has influenced this and brought it to the therapies. But this notion that all human beings, given the right circumstances, so if they're in a supportive environment with sufficient money, sufficient resources, sufficient, sufficient things that they need, sufficient support, they will make good choices, okay? And we don't need to take away their power and their autonomy. What we need to do rather is to try and support them to be in a good environment and have, the right supports around them so that they will make good choices for themselves. So it's really tempting in the drug and alcohol field to see the choices a person is making over time, and they might seem incredibly dangerous, incredibly risky, even foolish, illegal, and we sort of think, oh, that person is, their capacity to make good choices for themselves is really impaired. I think I'm in a better position to make choices for them. And we can try and coerce and control and influence and try and we sort of think, I think I know what's best for them. If they just did this, it would be far healthier, far safer. And we can really get hell-bent on pushing our own agenda onto them. And it's very disempowering, because what's that saying to that person? That's saying, you're not capable of making good choices in your own life. You need a worker to do it for you. And this ultimately is a very short-term goal. This is not going to lead to long-term change or empowerment of anyone. So rather, humanism calls us to really, if someone is making choices that are really risky or, that are having really difficult negative consequences and contributing to their suffering, in the long term, let's not disempower them and try to coerce them into doing what we think they should do. Rather, let's look at the circumstances that surround them, and as an AOD worker, let's do everything we can to improve the conditions around them and create conditions that are optimal for them being able to make great, clear choices for themselves. So what's their housing like? What's their financial situation like? Do they need support with Centrelink? Do they need some advocacy? Do they need support with employment? What's their family scenario like? Do they actually need some support reconnecting with family, with important relationships? Have they got a decent psychologist? Do they, can we support them to actually find someone who they can really work with in a meaningful way? All these things, all these basic needs, if they're in jeopardy and they're not being met, and the situation that's surrounding that person is not optimal, they're going to make choices to reflect that. And actually, do you know what? They are probably making very good, very sound choices that are helping them to survive and that are helping them to cope. However, we as a worker, we're not in their scenario, and it's easy for us to judge and say, whoa, the risk, that's huge, or, to pass judgment or to think that they're making reckless decisions, when actually I would probably put money on it if I was a gambler. They're probably making excellent decisions given the circumstances and given the needs and the priorities that they're facing. I think this is our final slide. By demonstrating respect, upholding rights is another active skill. And we're going to talk more about rights in this unit, and especially in your legal and ethical unit. But if you're able to master active listening, then you are well on your way to working with AOD clients in a manner that upholds their rights and really respects their autonomy and their self-determination.